Hi, good evening. It's 8 o'clock. This is Geoff with Real Progressives. I'm just going to get comfortable here. One day I'm going to get a system where this goes a lot better, and I'll be able to have graphics and music, and that's the dream. But it is April 4th, 2018. Hi, Les. So I'm going to be talking about single-payer healthcare. I'm going to be talking about specifically rural hospitals and what's going on in rural America and how we're going to be able to fix what's ailing us. But it is April 4th, and not just any April 4th. This is the 50th anniversary of the assassination of Martin Luther King Jr. I'm not going to talk too much about this. I've been thinking about it a lot. I've been thinking about him a lot in this last year, since I've been in the hot seat, since I've been doing these live streams, and I've come to the conclusion that there's a lot that I think about it, but I don't feel privileged to talk about it. I will simply say that I love the man, I love the message, and I want to talk just briefly about some of the things that I love so much about him. If you listen to the I Have a Dream speech, and I have a lot, there's one thing that sticks out like a sore thumb. And I've alluded to this before when I've spoken on these live streams about this in particular, but he's very, very clear that the anger and the injustice needs not ever and cannot ever devolve into hatred and bitterness. That the struggle must be a peaceful struggle, but a demanding struggle. We demand justice, but always with peace, always with love, always. And I can't tell you how touched I am by that, how moved I am by that. To have an entire generation, an entire group, that have been marginalized and brutalized and beaten and thrust upon the margins, and have poverty heaped upon them. And when they collectively come together and say, we do not accept this anymore, we will not accept it, they still preach about love. I am completely blown away by this. At every step, it's all about love. It is all about brotherhood. And when he talks about brotherhood, he's not simply talking about people that look like him. He was talking about white and black together in brotherhood, sisterhood, togetherness, united. I don't, for the life of me, understand how you can have the history that the African American community have had and come out the other end. They're not out of it yet, but still preach love. So the only thing I'm going to say about Martin Luther King today is to try to live up to that example. There is injustice everywhere. When I first woke up to the realities of MMT, modern monetary theory, I had always understood about injustice. I had always understood about the disparity between the haves and the have-nots. But when I found out about MMT and the way we have been lied together for decades, my head exploded. I saw red. But then I think about Martin Luther King, and I realize that yes, by all means be angry. By all means, be angry, because there are things to be angry about. But if you lose sight of love, if you lose sight of why you are angry in the first place, it's simply going to run away with you. It's going to run away from you. You're not going to get the outcome you're hoping for. Martin Luther King said 100 years later, and the Negro is not free. And I wish that were not true. But it was, and it is. And there's injustice everywhere, whether it's white, black, woman. The other thing I want to talk about is a lot of people try to co-opt, the African American struggle, the Native American struggle, and say that, well, there are white people that are catching hell too. And that's true. But it's not the same struggle. It's simply not. Can you be white and poor? Absolutely. Can you be white and systemically poor? Maybe. But it's still not the same struggle. And if we say, for example, that we're going to have a federal job guarantee with MMT, and we're going to have free health care and free education, and that is going to be true across the board, if we can make sure that not only that we have these things, but that it is equally distributed, everyone has access. I'm here to tell you, from my perspective, and it is only my perspective, that the struggle will still be there. Because if that's all we do, we have not first made an acknowledgement of what has happened historically in African American communities, to women, to Native Americans. There has been no acknowledgement. Even if everyone, starting now, were to share equally in all economic success, we're not starting from the same place. Emotionally, we have to have this acknowledgement. And then if you look historically, the African American community to date has not shared in the economic prosperity that was available to white America from 1940 until 1970. So while white America accumulated all this wealth, and to this day still holds it, the African American community has not been able to do so with as much success, by far. So it doesn't matter if we all equally share the success now, we're still starting at a disparity. We have to close that gap. Some people will call that reparations. I say it's justice. It's just justice. It's economic justice. It is looking at historical wrongs and realizing that you have to right it. You have to right the wrongs before you can truly move on. Anyway, that's all I'm going to say about that. I truly feel that it's not my struggle to talk about. But it being April 4th, it being the 50th anniversary, I felt I had to say something. And so my message is love. My message is love thy neighbor. Love thy neighbor as thyself. And you should not ever look to your neighbor to look like you. Black, white, man, woman, African American, Native American, Asian American, Latino American, it doesn't matter. You are my brother, you are my sister. We are one, and it is to our detriment to see differences. It is to our betterment to see unity. But tonight, what I wanted to do in general was talk about something that doesn't get a lot of press, doesn't get a lot of action. We talk a lot about single-payer health care, and we never really talk about where things really go wrong in different regions. One of the things that I've been thinking about a lot are hospital closings and what that means to a community. Right now, and this is largely true in states that did not adopt the Medicaid expansion, but it is not uniquely true. Right now, rural hospitals are catching a lot of hell. Rural hospitals are closing or at the risk of closing at an alarming rate. At least, I think it's like 80 rural hospitals have closed nationwide. 80. That's almost 2 per, or close enough to 2 per state to make me very uncomfortable. Now, what does it mean when a hospital closes? Now, one of the things that I think MMT shows us very clearly, if you look at the macroeconomic reality, is that things are complex. We have complicated problems, and the solutions, while not necessarily complex, are often looked at in isolation. We don't see cause and effect. We see a symptom, we want to treat the symptom. We don't look to the overall problem. So, chicken versus egg. If a hospital closes and the community collapses, did the community collapse because the hospital closed, or was the community already on its way out and that's why the hospital closed and the community finally fell apart after that? In my opinion, we have economic desperation throughout the country. We have wages that have been stagnant. We have GDP that keeps rising. What does this mean? What it means is that the country keeps producing. We keep producing wealth. But that production used to be in line with wages. As GDP went up, as wealth was created, our wages went up. And we did that for 30 years, from the end of World War II into the 1970s. But then something changed, and our wages flatlined, but GDP kept going up. Wealth kept getting created, but our wages stayed the same. So who was getting all that wealth? It wasn't us, it wasn't the working class, it was the wealthy, which became the ultra wealthy, which became the holy fuck they're wealthy, which became gods, economic gods. And we all stay the same. The standard of living keeps, the cost of living keeps going up. So our purchasing power keeps getting less and less and less and less and less. And then along comes NAFTA, we got the North American Trade Agreement going on, we got jobs going overseas. We were a manufacturing economy. And our jobs kept going away. And automation comes in and takes even more jobs away. There's a lot of reasons why jobs go, but the jobs are not being replaced. What used to be a high-paying job, now you can get a job, but it's a low-paying job. But we're satisfied because you have a job. So when we look at the unemployment rate of 4.4 or 4.8, whatever it happens to be at any given time, not only do we not pick apart those numbers to realize which demographics are actually doing well and which ones aren't, but we also don't look at what those jobs are. It could be a job at McDonald's, and we're still saying that's a job. So we have been doing worse and worse and worse and worse. And the manufacturing base has been going away. So what's happening in rural areas? It's bad enough in the cities, but in rural areas, entire communities are being decimated. It's already happening. And if you lose your hospital, that's like the death knell, because you're not really going to be able to attract new business. A business is not going to go to an area that doesn't have certain essential services. One of them has to be a hospital. So if you're already in an economic downturn, and that economic downturn means in a for-profit healthcare system that your hospital can't earn enough money to continue, then they will fail. And once they do, you can now be living in an area where you're going to have to drive 1 to 2 hours to get to a hospital. You want to take a second to realize just how insane that is. That you would have to drive 1 to 2 hours to go to a hospital. That you could also have a situation where if you're going to be going into a nursing home, you may have to go to a nursing home that is 1, 2, 3, 5, 7 hours away. Because there's nothing in your local community to take care of your need. This is what happens in for-profit healthcare. In order for you to stay afloat, in order for you to be able to operate the facility, you have to be able to make money. And if there's not much money to be made because your base, the people that would be giving you that money, the patients, can't pay because they don't have good paying jobs, they don't have insurance, you're not getting the revenue that you need at your facility, eventually it all just comes crashing down. So as bad as things are in the cities, and they are bad, because remember what I said, we're taking high-paying jobs and we're turning them into low-paying jobs. You are taking full-time work and you're making a lot of part-time work instead. In order to make ends meet, you have to make 1, 2, 3, 4 part-time jobs. Or even a full-time job that doesn't pay very much, and you got to take 1 or 2 part-time jobs to fill in the gaps. But we would then say that you are gainfully employed. So let's unpack this a little bit. If you want to fix any one thing that we're talking about, healthcare, education, if you want to fix the unemployment, you want to fix the economy, all these things are interconnected. You're not going to deal with anything if you deal with them in isolation. You will fix a symptom, maybe, but the disease will continue. So what are we going to do? In my opinion, the first thing we have to do, the very first thing, is realize what our operational reality is on a macroeconomic basis. If we realize that Article 1, Section 8 of the United States Constitution mandates that Congress and only Congress creates the currency. You don't create it. I don't create it. Corporations don't create it. Every dollar that you have ever seen, let alone had or held in your hand, was created by the federal government. That's high-powered money created by the government. Not bank money, not money you got from a loan. That's a zero-sum game. We can talk about that later if you'd like. But the federal government creates the currency. Article 1, Section 8. It creates the currency. It sets its value. It tells you what it is worth. And there was a time when it was worth gold. When the federal government said that if you have this dollar and you bring it to the Federal Reserve, we will exchange that for gold. And when we did that, when we placed an arbitrary constraint, remember, Congress chooses. They tell us what it's worth. And if they tell us it's worth gold, and gold is finite, there's only so much gold, then we have real fiscal constraints because we can't have more money in circulation than we have gold. If we have, 1 pound of gold is going to be worth $1. It's a very expensive dollar, but let's say it's 1 pound to $1, and we have 100 billion pounds of gold, we could only have $100 billion in circulation. So we have to be careful what we spend on, how much we spend. We get that. But in 1934, we went off the gold standard domestically, and in 1971 internationally. We now have a free-floating fiat, which means at-will currency. It is backed by the full faith and credit of the United States government. That's it. Article 1, Section 8, look it up. They create the currency, they tell us what it's worth, and they create demand for that currency through taxation. The whole purpose, the whole reason you need dollars is because there is one obligation you have financially that cannot be satisfied with anything but US dollars, and that is your tax obligation. That's it. Just think about any other need or want that you have. It's a pain in the ass, but if you needed to, if you wanted to, you could satisfy all your other needs and wants through barter. You can exchange goods and services for food, for lodging, for transportation, for clothing. It would be a pain in the ass. You would have to be able to find someone who had what you had, who wanted what you had, who also had what you needed. It's the coincidence of need. It's a pain in the ass, but you can do it. But there's one thing that you can't do. You cannot exchange goods and services for your tax obligation to the federal government. They're not going to do it. So you now need dollars. That's what drives the currency. That's what creates the value of the currency. You need it. Everyone needs it. The business that you go to will accept US dollars. Why? Because they need it to pay their tax obligation. It becomes a very convenient form of exchange of goods and services. But the reason we use it, the reason we use US dollars is because the federal government tells us if you don't pay us our taxes, we will punish you. We will imprison you. We will garnish your wages. We will confiscate your house, your car, your possessions. You don't want that to happen? You're now in the business of getting US dollars. They are currency issuers. You, me, corporations, states, municipalities, they are all currency users. And there is a palpable difference. For everyone else, from the state of New York to the city of New York to the corporations that are in New York to the population of New York, you all use US dollars. And for everything you want to do financially, you need US dollars to do it. But the federal government, if it wants to do something, all it has to do is decide. This is what we want to do. This is how much we're going to pay for it. Congress will write a bill. The president will sign it. That money has now been created. That money now exists because Congress decided to do it. They didn't have to get your taxes to pay for it. They didn't have to borrow any money to pay for it. They decided to do it. They wrote the bill. The president signs it. It is now deposited in the United States Treasury. That's how that works. That's MMT. It is currency analysis, nothing more. But once you understand what that analysis is telling us, we are no longer constrained by money. We no longer have to be held back because of arbitrary pieces of paper. We can now open up our policies. We can now open up the possibility of what we can do. We now get to have conversations about what are our priorities as a nation. What do we want to accomplish? And the first person that stands up and says, yeah, but how are you going to pay for it? That person doesn't understand where money comes from. That person is thinking we're either still on a gold standard or thinks that the government has to borrow money, beg it from someone else. How can that possibly be? It creates the currency. If you had a printing press in your basement, you wouldn't ever need to have someone pay you in your own currency before you could spend it. Fiscally speaking, we have no constraints. But before we start doing the dance of joy, let's remember we do have constraints. The constraint just isn't money. The constraint isn't how you're going to pay for it. The constraint is inflation. And that is resource-based, not money-based. For anything the federal government wants, it can pay for if it's for sale in its own currency. If it wants to pay $13 trillion for whatever it is, it can do that. So the only thing that we have to worry about is, should we do that? Is it a good investment? Is it a good use of our resources? Not our money, our resources. Take single payer as an example. Single payer, for me, is a program that says whatever your medical needs are, they are now met. 100%. From womb to tomb. I don't care if it's a hangnail. I don't care if it's plastic surgery. I don't care. It is met. Elective surgery, emergency surgery, whatever it happens to be, it is met. And it's all free to the user. Your federal government. We, the people, we are the federal government. It's not some random person. We're not looking to our neighbors to pay for us. We are all collectively saying, this is what our priorities are, and our priorities are health. So we are going to prioritize health instead of bombs. And quite honestly, we don't have to do it instead of bombs. We don't have to stop the military-industrial complex before we do this. We can do both at the same time as long as they're not competing for the same resources. So single payer takes care of everything. And not only does it take care of everything and everyone, it takes care of everything and everyone everywhere. It doesn't matter where you live. If there is a population that has medical needs, we set up a hospital. And we fund that hospital. And we give that hospital the resources that it needs to fund, to actively take care of patients. Because it doesn't matter how much it costs. It only matters if we have the resources to do it and then the political will to make sure that it gets done. And never forget, we the people of the United States of America, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, support the general welfare, secure the blessings of liberty to ourselves and our posterity, to ordain and establish this Constitution of the United States of America. That means we, the people, are the government. It is not simply the people we send to Washington. They are not the government. We are the government. We decide. Now, it is representational democracy, but they have to represent us. They have to be able to understand what our needs are and agree to go and get it done. And if they don't, then we get rid of them. That's the deal. Say what you will about the Constitution, good and bad, and I can say good and bad aplenty about it. But the one thing they got right, there's a couple of things they got right, but right up there at the beginning, the preamble tells us what they were trying to do. Establish justice. They didn't say establish justice for a few. Now I get, 1776, they meant just basically the white gentry, and you had to be rich. We know what they actually meant, but you know what? They were wrong in so many ways. But we get to decide as we move through time what the Constitution means today. It is a living document. We get to decide, every generation. It is our responsibility to decide. Does the Constitution still represent our modern values? Does it still grant opportunity to everyone? Does it need to be amended? Does it need to be changed? Do we need to reinterpret what it means? That is our responsibility as citizens. And the preamble gives us the framework. We, the people, not the oligarchs, not the plutocracy, not the rich, not the people we send, us, we the people. In order to form a more perfect union, we're not done. They knew right then and there that it was going to be an ongoing process. They put that in the Constitution's preamble, and they also allowed for the Constitution to be amended. They understood in all their lack of glory, of being misogynist and engaging in genocide and being racist, all of that. They still understood that the Constitution needed to be a living document, that it needed to be amended, that future generations would have to take a closer look and see if it still worked for them. We the people, in order to form a more perfect union, establish justice, ensure domestic tranquility. How can there be domestic tranquility if my local hospital just closed? if I have to drive hours for emergency care, there is no domestic tranquility under such conditions. To watch your family sicken and die, those are the blessings of liberty. I have the liberty to limp along and to eventually die, or God forbid, to be cast out of my home because I got bankrupt through medical bills. That is not securing the blessings of liberty. Provide for the common defense, sure. But promote the general welfare. We are the government. Government is neither a problem nor a solution. In 1980, when Reagan came up and said it's morning in America, the government is not the solution to your problem, it is the problem itself, that was a lie. Government is neither a problem nor a solution, but the people we send there are the problem or the solution. You get me? You understand? It matters very much who goes. So this blue no matter who bullshit has got to stop, because it matters very much who goes. I understand the desperation. We have Donald Trump in the White House. I want him embarrassed. I want him imprisoned. I want him gone. I cannot believe that you could act as he has acted his entire life, done what he has done, ran the kind of campaign that he ran, and it's still acceptable that he occupied that office. I can't stand it. For the good of the country, he has to be taken down. Not violently. Peaceably. Lawfully. However, blue, no matter who, doesn't get us the result we want. It might get us the end of Donald Trump, maybe. But what comes next? It's unacceptable to just keep sending people there who might get rid of Donald Trump, but who will continue the policies of austerity, who will continue to tell us that we can't afford single-payer health care, that we can't afford free college tuition, that we can't afford green energy, who are going to be in bed with the fossil fuel industry, who will be in bed with big agriculture, which allows us to continuously get sick, who will be in bed with Wall Street, who continuously prey on us with predatory lending and making sure that our economic desperation is funded with private debt, our debt. Debt is unsustainable is an opinion. It needs context. Federal debt is sustainable. Because we create the currency, we can always be able to pay our bills, always be able to pay whatever obligations we have. We can never become insolvent. We can never be forced into bankruptcy as a nation unless we do stupid shit, like Russia did in the 90s by choosing not to be able to pay their bills, by taking on debt in a foreign denominated currency. If we do stupid shit, we can have bad results. But right now, we have a free-floating fiat currency. It's a currency that we control. We don't have debt denominated in foreign currencies. Ergo, it's not debt. But we have real debt. If we don't have enough to pay for our lives through our paychecks, we will have to go to a credit card. We will have to go to a bank. We will have to borrow money. And that money must be repaid with interest. And it can't be repaid with money we create in our basement like the federal government does. It has to be repaid through a job. It has to be repaid through things that we have sold, like our souls. It has to be repaid through money that we have borrowed to pay back money that we have borrowed. Interest upon interest. It is economic slavery. It is indentured servitude. And Wall Street loves that shit. They make billions of dollars off of us. So look at everything that we have arrayed against us. We have a food system that has turned food into crack, that has turned food into poison, They are pumping sugar into everything. If you want to eat healthy, you have to spend more money. You have to be really educated, and you have to do that on your own because the federal government doesn't give a shit. Because the federal government is, on the one hand, with the FDA trying to tell you what nutrition is, and on the other hand, getting in bed with the meat and dairy industry and the sugar industry to ensure that we keep getting sick. And they tell us that it's our fault. And they keep advertising. Everywhere that you go, you see an advertisement for fast food, an advertisement for junk food, an advertisement for things that are supposed to be healthy, but it turns out actually is junk food. All these granola bars, what a wonderful substitute for a meal. But it's got more sugar in one serving than you should have in your entire day. They're making us sick. They're doing it on purpose. Now, I'm prepared to believe that the industry, the food industry, is not trying to make us sick. They're trying to make a buck. And they know how to do it. They know how to put in poison in the form of sugars into the food, salts and fats, doing it so that you want it, so that you crave it. They're trying to make you addicted. And they are succeeding at an alarming rate. Look at the obesity rates that we have in this country. Look at the diabetes in children. Then look at the advertising. They're allowed to advertise all this crap. How long did it take for them to not be allowed to advertise cigarettes? It took a fucking long time. Cigarettes are a problem, but sugars is just as big a problem. Easily as big a problem. You can walk into a pharmacy to get your diabetic, high blood pressure, and cholesterol medications, and then walk out to the cash register, and what's in front of you? Snickers bars, M&Ms, crap. Everything that got you in that pharmacy in the first place. They got you in the front end and the back end. So they make you sick. And they tell you that it's your fault. And the government lets them advertise. It's poison. They let them advertise. The FDA, if you look on your food, if you go into the grocery store, look at any piece on the shelf, and you will see what they have on their nutritional information. You will see the cholesterol levels and the protein levels and the sugar levels and the fat levels. And they will show you how many grams you're having per. And then next to that, you will have the percent daily allowance. And for everything else, you'll have the percent daily allowance. Except for one, sugars. They don't want you to know how much sugar you're putting in your body per serving. Because you may not know how many grams of sugar you should take. We don't educate on that. But any American is going to know what 100% is. 110%, 150%. And they don't want you to know. So that will not be on a label. And do you think for a second that it's the FDA that told the sugar industry, you know what, we're not going to let you put the percent daily allowance on our labels? No. The sugar industry tells the government, we're not going to let you put the percent daily allowance on your labels. The industry told the government. The industry dictated to us because we are the government. So when Republicans, politicians, people on the radio, people on the television say that it's our fault if we're sick and fat, I can go along with that. In as much as this, we let them do it to us by not doing anything. And I absolutely am sympathetic to that. We designed a system whereby you don't have to get involved. I didn't get involved. For almost my entire life, I was aware I didn't get involved. I kept sending people to get involved for me. Please, sir, will you please take care of this for me? And we keep losing our minds every time they don't. Because they don't work for us. They work for someone else. So they make us sick. And now we have to go to the hospital. We have to go to the hospital a lot more. But we have economic desperation. Our wages are not rising. We don't have the money. We can't afford our health care. So what happens? We get sicker. We have more disease. We have more need of medical care, but we can't afford to get that medical care. So rural hospitals especially get hard hit. Like I said, 80 have closed in the last several years alone. And easily 5, 6, I think up to 700 are at risk across the country of closing any moment now. Can you imagine the calamity of upwards of 600 to 700 hospitals closing nationally? Can you imagine the death toll that that would wreak all over the nation? And it's on the brink of happening. Eventually, a dam that does not get regular maintenance, cracks will show. Leaks will start. Leaks will become small rivers, and then eventually, the whole thing blows apart. They make us sick. They ruin our educational system. They ruin our medical system. And why? Money. Like I said, in 1980, government became the problem, not the solution. Why would they say that? Because if there's money to be made, and there is a lot of money to be made in healthcare, there's a lot of money to be made in education, there's a lot of money to be made in food production, there is a lot of money to be made in fossil fuels. If there's money to be made, government is not allowed to do it. Government is labeled the problem. It is labeled inefficient, incapable, too much red tape. You need people with innovation. You need people with motivation. And no one's going to be motivated if there's not a huge payout. So government is labeled the problem. Notice I said labeled. Because government is not the problem. It is not the problem, nor is it the solution. The people that go are. You send the right people, government becomes your solution. You send the wrong people, government becomes the problem. Even if they're there to solve the problem, if they're incompetent, they become the problem. But big industry spends a lot of money buying up a lot of people, a lot of politicians, telling you that government is the problem, that it can't get it done. They tell you that the government is like a household, that it can't spend what it doesn't earn. That it's your tax dollars. You don't want your tax dollars going towards X, Y, and Z, do you? They don't want you knowing that the federal government is not fiscally constrained. They don't want you knowing that it's not your tax dollars going to pay towards anything. It is our shared resources. That the money that you earn, you can keep. We need to tax at least a little bit to keep the currency in demand. That's it. After that, there's other reasons for taxes. Help us control inflation, help, influence behaviors, but by and large, the first and most important reason for taxes is to drive the currency, to create the need for the currency. If a government loses the power to tax, the currency is gone. So government needs to tax you. It is not theft, but it also is not buying us shit. It is creating the conditions under which we can have all this shit. Government is the solution if we send the right people, if we send people that understand the macroeconomic reality. And we're not going to get that until we understand the macroeconomic reality, until we understand that we have been lied to, until we demand that we're not going to accept less, that we will not accept incrementalism, that we will not accept people that want to keep us down so they can stay up. This is the power of collective bargaining. We need to get back our power of collective bargaining. So our first and largest challenge is to wake up as many people as possible. All these hospitals that are closing do not need to close. If we had single-payer health care, they would all be funded 100%. We could open up more hospitals. It's a question of resources. Do we have the resources in infrastructure, in hospitals, in clinics, in doctors, in nurses, in pharmaceutical equipment, in pharmaceutical drugs? Do we have everything that we would need to be able to deal with the medical needs of an entire nation? If we could do that, what a wonderful world it would be. If we have the resources, it's a done deal. If we don't have the resources, the question becomes, can we marshal our resources? If we don't have enough hospitals, can we build the hospitals? Do we have the concrete, steel, etc., 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 to build the hospitals? Yes? Then do that. And then we get Medicare for all. If we don't, can we import it? Can we import concrete and steel? Do we need to import doctors? Do we need to import other medical professionals? Do we need to educate them? Do we need to create better education? Yes, we do. But the question is, do we have it? If we don't, can we get it? Either domestically or internationally by importing it. It's about resources. It's not about money. The question is never, can we afford it? The question is never, how are you going to pay for it? Because that sets up a mindset that says, you need my money. I don't have enough money as it is. I barely make it by on my paycheck. And I'm talking me personally, Geoff Kinter, I barely make it by with my paycheck. So I don't have financial wiggle room to play around with to be able to, if it was my money that had to fund Medicare for all, that's a problem. But the federal government does not have that problem. It matters about resources. So I want to talk about other forms of governments. Because there's a lot of talk about, well, the federal government's not going to do it. Why don't we get the states to do it? You know, New York wants to do it. Vermont wants to do it. California is trying to do it. New Jersey is trying to do it. There's a lot of different states trying to do their own single-payer health care. And I see a lot of people say, let's do that. I see a lot of people say, let's not do that. And the arguments on both sides are varied. My personal opinion, don't do that. Don't do that. And here's my reasoning. It's not because the states can't technically set up their own program. Of course they can. They can set up any program they want. And it's not that states cannot be successful to greater or smaller degrees with various programs and initiatives that they have. They can be. They have been. There's numerous examples of states doing wonderful things. But this is the big thing. This is the big thing. And healthcare is expensive. Now, when I say single payer on a national level, you know, we can pay for whatever. Doesn't mean that we should not try to bring down costs. It's criminal what some people are charging. It's criminal the way they have monetized our lives and our deaths. And it's criminal because the way that it's being done for profit off of our backs. It's being done for profit off the backs of the people who are currency users. That's what makes it criminal. But if they're still charging as much as they feel they can get away with, and they're simply giving the bills to someone that doesn't care how much it costs, the federal government can pay whatever, it's still wrong. You know, we want you to have a great life. We want you to make a really good living. You're doing one of the most important jobs. But come on, dude. You know, there's got to be a limit. There's got to be a cap. Not because there is a fiscal constraint, but because you're being a dick. You know. But if the states try to do their own single-payer healthcare systems, they have to raise revenues. They have to sell bonds. They have to borrow money. They have to do or cut programs. They have to do whatever they do. They do have to start looking through the couch cushion, so to speak, to find the money to do it, because healthcare is expensive. And you'll need to start cutting corners. You'll need to start finding ways to trim the fat, which makes it still a for-profit business model. If you're looking for ways to trim the fat because you have to be able to save money, like I said, the federal government can trim the fat and not pay quite so much, not because it needs to, but because you got to be able to just rein in the greed. We can mandate that everything is done safely, that we have proper nurse staffing ratios, as an example, that we can make sure that we have tort reform so that doctors don't have to feel they got to cover their ass with unnecessary testing. There's all manner of things that we can mandate and do and have everything safe, and everyone still makes a great living. On the state level, it becomes for profit. And all these things, you know, they start cutting back on nurses. They start cutting back on all manner of things, and we're going to have a problem. 220,000 people die every year in this country due to medical errors. 220,000 people every year. That's a conservative estimate. And that is the direct result of fee-for-service, which is the direct result of for-profit health care. And that will not go away, even if you fully fund the ACA. Even if you make single-payer health care on a state-by-state basis, we will not deal with that problem. We will not be able to mitigate those deaths until we eliminate for-profit health care. If you are in business, your first and most important question is going to be, how do I make the most money off of this? Now, say what you will about capitalism, but that's the way that it works. You'll always hear them say they have a fiduciary responsibility to their shareholders. We got to get the most return, whatever. If you're in business, your first question is, how do I make the most money? If you're in healthcare, the Hippocratic Oath specifically states, first, do no harm. So if you're in healthcare, your first question is and must be, what is in the best interest of my patient? And many times, what is in the best interest of your patient is a money-losing proposition. And it must be so. So if you are in business, you can't be in healthcare. If you're in healthcare, you can't be in business. One is anathema to the other. So state-run single-payer healthcare is still for profit. You can say that the state is become the insurance company and the federal government becomes the insurance company. But there is a difference. The state needs to turn a profit, or at the very least break even. The federal government doesn't care. The federal government can't care if it wants to do the right thing. The federal government needs no revenue. It is constrained by resources and resources alone. Ergo, the deficit can be big or small. It doesn't matter how big or how small until we get to full employment, until we start running an inflationary risk. But here's the thing about inflation. Take single-payer health care. 45,000 people die every year in this country because they can't access health care. Not insurance, health care. 220,000 people die every year due to medical errors, which is the direct result of for-profit health care. So upwards of 300,000 people die every year under our current system. They are preventable deaths, almost 300,000. Compare that to the risk, only the risk, of a little bit of inflation. And we can save all these lives. And the only thing we risk is a little bit of inflation. By trying to avoid inflation, we're killing upwards of 300,000 people a year, and that's just due to healthcare. That is not due to bankruptcies and homelessness and economic starvation. Just 300,000 people a year, only due to... Anyway, I know I'm coming up to an hour, so I'm going to call it here. I just wanted to be able to sign off properly. My apologies to everyone I know. I was in the middle of a rant. So I just want to, sum up. Just a brief summation. I don't want to miss Savage Joy tonight. It's going to be a great conversation on Real Progressives. So just to sum up, remember, there is a difference between a currency user and a currency issuer. The federal government doesn't need to have a profit. It doesn't ever need to have revenue. Ergo, when it comes to single payer, it can pay for whatever is necessary. And we can do away with for-profit healthcare, which leads to upwards of 300,000 people dying every year. So if we want to run the risk of a little bit of inflation, we can save all these people. And it's just a risk. Remember, there are multiple kinds of inflation. Creeping inflation versus hyperinflation. When people talk about inflation, they usually are afraid of hyperinflation, where things are going up 100, 200, 300, 400% per day. We're not in danger of that happening. Something like that has to be in the context of a calamitous event, where our productive capacity is destroyed because of a war, or some stupid thing that we did because we started taking debt in foreign currency, or what have you. It's not going to happen in the United States. We might have an inflationary issue, maybe, if we start paying to the public purpose. But there's a good reason to believe that single-payer healthcare will be deflationary, because we will be spending less. It'll be cheaper. We will be able to get better outcomes. Less money in circulation, ergo cheaper, ergo less inflationary, deflationary. But either way, even if we did run the risk of a little bit of inflation, would that not be a better risk than the knowledge that we are clearly, just with healthcare alone, killing up to 300,000 people every year? Would you not want to risk, mind you, risk a little bit of inflation if it meant saving annually 600,000 people? To me, it's a no-brainer. It's an absolute no-brainer. And that's just with healthcare. Imagine what we can do, the lives we could save if we could get a federal job guarantee. Everyone is employed. Everyone is gainfully employed with a good job, with good wages, doing work that they loved, doing work that would be meaningful, doing work that would build their communities. The rural hospitals I talked about closing, they got into trouble in the first place because their economy was in trouble, their local economy. A federal job guarantee would eliminate that. You wouldn't have to lose your home anymore. You wouldn't have to go bankrupt anymore. You wouldn't have to go to predatory lending anymore. Trying to call me. Hope that didn't freeze. The hospital wouldn't be in trouble in the first place. So just remember what our macroeconomic realities are, what they truly are. What we could actually achieve if we could give everyone a job, and we can. If we can do single-payer health care for everyone, and we can. If we can do college education for everyone, if we can. Remember, it's resource constrained. I'm not saying we can do all of this tomorrow. I'm saying that if we have the resources to do it, it's done. And lives will be saved. It's a little bit of inflationary risk or death. That's really what it's down to. I'm going to be back next week. I'm going to actually start doing more produced videos. I'm going to do fewer and fewer live streams, but my Mac is in disarray right now. So I'll probably do one more live stream next week. And then I'm going to start working on some more shorter promotional videos and things like that for Real Progressives. But I love you guys. Take care of one another. Remember love. Remember Martin Luther King. Remember what he stood for, what he dreamed of, what we still dream of, what it still has to be a dream. It doesn't have to be a dream. Martin Luther King, I have a dream today. We can have a reality today. We can make those dreams reality. We have that power. We have that responsibility. So wake up your neighbors, your friends, your enemies. Talk to people. The risks of not doing this are calamitous. We know where that road goes. And it's austerity, it's death, it's destruction, it's wasteful, it's needless, it's pointless. But it makes some very powerful people very happy because it makes them very rich. I don't care about their money, but we're coming for their power. They're going to start working for us now. I'll be back next week. Savage Joy is coming up live in just a few moments. I love you guys. Have a great day. Happy Martin Luther King. Love you.